ADHD, or attention deficit hyperactivity disorder, is often thought to be a childhood condition, but an estimated 8 million adults are affected by it. A long-term study out this morning finds the disorder takes a heavy toll in our later years. Dr. William Barbarisi of Boston Children's Hospital led the study. Welcome.
Thank you.
So the study suggests that there is a number of adults who continue to show what they discovered that they had when they were very young.
That's right. In fact, it turns out that 30% of children with ADHD continue to have the disorder on into adulthood.
And what's it like in adulthood?
Well, ADHD affects adults in many of the ways that it does children. So there are problems with attention, distractibility, disorganization, productivity. It's just that those problems play out in the adult world of employment, education, adult relationships, unfortunately, risk-taking behaviors.
And one of the other fascinating things that you found is that 80% of those adults who have ADHD also have at least one other psychiatric disorder. What are we talking about?
That's right. We tend to think of ADHD as just the attention problem, but in fact, most individuals with ADHD have associated learning or mental health problems. In adulthood, they include problems with alcohol and drug abuse, antisocial personality disorder, depression, and anxiety.
I assume that you long suspected this. You've been able now just to prove it.
Yes, and the reason that I think this information is important is because it's such a long-term study with such a large group of children representing the whole universe of people with this condition.
And so how will it change the way you treat?
Well, I think what we need to do is, first of all, stop trivializing ADHD and sensationalizing it as just an annoying childhood behavior problem. In fact, it is a serious chronic health problem starting in childhood, and that continues to have a significant impact on into adulthood for most affected children.
So there are many parents and grandparents that may be listening to this and say, wow, I have someone in my family with ADHD. What does this mean for their future?
Well, what it means is that treatment needs to be by qualified individuals, it needs to start early, and that we need to reform our healthcare system so that we treat this as a chronic medical condition worthy of our attention for the long haul, not just in young children.
But is ADHD often misdiagnosed?
Well, I think that if you look at the press coverage that ADHD gets, it tends to focus on misdiagnosis or poor treatment. But let's face it, that happens in other medical conditions.
Right.
And we're still unwilling as a society to think of mental health problems in the same way. And so I think that's why you have this sensationalized approach to ADHD.
So what's the number one thing you will do now that you have this study and these findings?
What we are going to be doing at Boston Children's Hospital is focusing on not just early identification, but building systems of care to keep children in treatment so that we can help to prevent some of the adverse outcomes that we found in our study.
Dr. William Barbarisi, thank you so much. Good to see you.
Thank you for having me.